If you've had elbow pain for months, pain with gripping, or your Achilles tendon flares every time you run, maybe your patellar tendon hurts when you squat or jump, you've probably been told it's inflammation or tendonitis. That's probably not accurate if it's been happening that long. Most chronic tendonitis isn't inflammatory, it's degenerative. The term tendonitis refers to an acute inflammation of a tissue. True tendonitis, meaning inflammatory, usually occurs after an early overload and resolves within a short window. When pain lasts 6 to 8 weeks, we're typically dealing with a tendinopathy, more specifically, disorganized collagen fibers that have a reduced tensile strength. It's poor load tolerance that creates this pain. And when it doesn't heal properly, it turns into more of a degenerative change. This change is not ongoing inflammation. Icing it and anti-inflammatories aren't going to fix it. It's more of a capacity problem. We need to rebuild the capacity of those tendons. Lateral elbow pain, often called tennis elbow, is usually common degeneration of the extensor tendon. Achilles tendinopathy happens with repetitive loading when it exceeds the tendon's ability to adapt to the stress and the strain. Patellar tendon pain or jumper's knee develops when high forces outpace tissue recovery. In all three cases, the tendons didn't fail because it was inflamed. It failed because it wasn't tolerating load well anymore. Rest may reduce symptoms, ibuprofen may reduce symptoms, but only temporarily. Tendons respond to load, so if you remove load completely, the collagen alignment worsens and tendon stiffness decreases and capacity drops even further. Then when you return to activity, it flares up again. That's the cycle we see with tendonitis. The solution is not no load, but it's the right load and the right progression of load. Manual therapy, instrument-assisted soft tissue work, joint mobilizations can all help improve local circulation, reduce the muscle tone, improve joint mechanics, and create a window of reduced pain. This allows better quality of loading. Wall sits are popular for patellar tendonitis, calf isometric holds for Achilles, wrist extension hold isometrics for elbow pain. These are all part of the early rehab program because they help reduce the pain and start increasing the tolerance of the tissues. We're not trying to avoid load. We're trying to introduce it strategically so that you can heal. Once isometric loading is well tolerated, we add in slow eccentric loading. This is loading a tendon while we are lengthening it. Progressive tensile loading helps the collagen fibers align along the lines of stress. Loading the tendons signal the body to remodel and repair. Another powerful modality we use in our office frequently is a shockwave therapy. It's focused shockwave therapy. It stimulates increase in fibroblast activity, which these are the cells that help heal and lay down new tissue. It also promotes new blood flow to the area, new vascularization, which is essential in the recovery process. Shockwave therapy can seem magical at times because it does work quite well, but it's backed by solid evidence that supports tissue healing. Nutritional support is also very important. Supplements are not a replacement for the rehab and the loading of tendons, but they're a nice adjunct. Evidence-supported options for supplementation. 10 to 15 grams of collagen taken 30 to 60 minutes before your rehab. Also with vitamin C, helps the uptake of collagen in those areas. Omega-3 fatty acids are also important to improve tissue health. Creatine can be very helpful for increasing tolerance of tissues and building strength. Adequate protein is also essential, as protein are the building blocks of your muscles and tissues. So make sure you get the proper nutritional support to supplement your rehab plan. Chronic tendon pain is not something you stretch away, you don't ice it away, you need to actually load it properly. At Function Performance, we are sports chiropractors. We work with tendon issues every day, and we typically see great results.